Hello friends, I am Dr. Sonu Yadav. Today's topic of discussion is leukopoiesis. Now, coming on to the definition. Leukopoiesis is formation of white blood cell. So, the process of development and maturation of white blood cell, that is leukocyte, is called leukopoiesis. It is known as leukopoiesis because white blood cells, also known as leukocytes, they are the cells of immune system. So they help in defending the body against infections and foreign material. They play important role in immunity. Their normal reference range. At birth, the count is little higher as compared to adults. It is between 10,000 to 26,000 per microliter. In adults, the normal reference range is 4,000 to 11,000 per microliter. At 1 year, it is between 6,000 to 16,000 per microliter. This is the normal reference range in adults, that is 4 to 11,000. Now, coming on to the types of white blood cells. They are divided into two types on the basis of granules in their cytoplasm. The cells in which granules are not present in their cytoplasm known as agranulocyte, and the cell in which granules are present, they are known as granulocytes. The example of granulocytes are neutrophil, eosinophil and basophil. Agranulocytes, lymphocyte and monocyte. So basically, formation of white blood cell, it involves three series. First is formation of granulocytes. This is one series known as myeloid series. Formation of granulocytes. Then formation of monocyte. Macrophage is known as monocyte macrophage series. Formation of lymphocyte known as lymphoid series. So, white blood cells, they are divided into agranulocytes and granulocytes on the basis of granules present or not in their cytoplasm. If granules are not present, they are known as agranulocytes, and if granules are present, then they are referred to as granulocytes. There are three examples of granulocyte: neutrophil, eosinophil, basophil. And agranulocytes are lymphocyte and monocyte. Now coming on to the differential count of white blood cells. Neutrophil, the most numerous in all white blood cells, that is 40 to 80%. Eosinophil, it constitutes 1 to 4%. Basophil, it is between 0.5 to 2%. Lymphocyte constitute 20 to 45% of all white blood cells. Monocyte is 4 to 8%. So remember, the most numerous is neutrophil. It constitute 40 to 80%. Then lymphocyte, that is 20 to 45. Now, formation of leukopoiesis, that is white blood cells. It involves formation of granulocytes, monocytes and lymphocytes. Formation of granulocyte is known as granulopoiesis. Formation of monocytes known as monopoiesis. Lymphocyte, lymphopoiesis. Basically, poiesis means formation. Now it involved development of three series, that is development of granulocyte, myeloid series, development of monocyte macrophage series, development of lymphoid series. There are various stages in each series. So first of all, we are going to study myeloid series, that is development of granulocytes. And as you already know, there are three granulocytes: neutrophil, eosinophil and basophil. We are going to study the various stages involved in formation of granulocytes, that is neutrophil, eosinophil and basophil, and their development series is known as myeloid series. So these are the various stages of development of granulocytes, that is neutrophil, eosinophil and basophil. So the stages are myeloblast, promyelocyte, myelocyte, metamyelocyte, band form, then mature granulocyte, which can be neutrophil, eosinophil, basophil. They are distinguished on the basis of their granules, nucleus feature and cytoplasm. So mature granulocyte can be neutrophil, eosinophil or basophil, and these are the various stages involved in the mature form. Now coming on to the stages. These are the characteristic features of various stages. So first stage is myeloblast. Always remember, blast is the first immature form of any mature blood cell. So for myeloid, the myeloblast, the size is between 12 to 20 micron and NC ratio is high, that is 4:1. Nucleus is 4 times as compared to cytoplasm, as you can see in the diagram also. The cytoplasm is less as compared to nucleus. Nucleus occupies most of the cell. So these are the features on the basis of which various cells are described. We always define all the stages on the basis of size, NC ratio, nucleus, cytoplasm and granules. All the stages, whether it is myeloid series, whether it is lymphoid series or whether it is monocyte macrophage series, we have to discuss NC ratio, nucleus, cytoplasm or granules. If they are agranulocytes, that is monocyte and lymphocyte, so this can be excluded. So, and the size and NC ratio in myeloid series, as we move from immature to mature form, decreases size as well as NC ratio. So coming on to the first stage, that is myeloblast, the size is between 12 to 20 micron and the NC ratio is 4:1, that is nucleus is 4 times as compared to cytoplasm. Now coming on to nucleus, whenever we are going to discuss the nucleus characteristic feature, they are discussed on the basis of 4 points. That is, first we'll discuss shape of the nucleus, then color of the nucleus, then chromatin, and then nucleoli. These are the 4 features we are going to discuss in nucleus characteristic features. So first coming on to shape, the shape is round, the color is purple and chromatin is delicate and dispersed, and there are 2 to 3 nucleoli, as you can see these white spots. Now coming on to cytoplasm, we have to tell the color. So in myeloblast, the cytoplasm is pale to deep blue, and there are no granules at this stage. So for myeloblast, this is the first immature form in myeloid series. The size is between 12 to 20 micron. NC ratio is 4:1. The nucleus is round, purple color, and the fine chromatin dispersed, and there are nucleoli, 2 to 3 nucleoli. The cytoplasm is pale to deep blue, and there are no granules. Then coming on to the next stage, that is promyelocyte. So size will decrease, but in this the size is almost same. The NC ratio is decreased. In this, the nucleus, the shape is round to oval. The nucleus can be placed in center or eccentric. Then the color is purple and the chromatin is coarser. As we move downwards, it becomes fine to coarse chromatin. So the shape is round to oval. The nucleus can be centrally placed or eccentric. The color is purple. Chromatin become coarser, and there are nucleoli 2 to 3. Sometimes they are visible, sometimes not visible. But they have granules, dark blue to reddish blue. Here I have shown blue granules. They can be dark blue to reddish blue. And the cytoplasm is blue. So these are the characteristic feature of promyelocyte, that is size is between 15 to 21 micron. In this, the myeloblast and promyelocyte are somewhat similar size. Rest other stages, as we move downward, the size will decrease. The NC ratio is 3:1. There is more cytoplasm as compared to myeloblast. The nuclear shape is round to oval. It is centrally or eccentrically placed. The color is of the nucleus is purple, and the chromatin is coarser as compared to myeloblast, and there are 2 to 3 nucleoli, sometimes visible, sometimes not. The cytoplasm is blue in color, and there are granules which are dark blue to reddish blue, as you can see. Now next, as we know, we are studying the maturation of granulocytes. So there are 3 granulocytes: eosinophil, neutrophil, basophil. So the next stage, I have shown the next stage for all the 3 granulocytes. The next stage is myelocyte. So depending upon the characteristic feature, it can be eosinophil myelocyte, neutrophil myelocyte, or basophil myelocyte. It will depend upon their nuclear and cytoplasmic features and the color of granules. So coming on to the eosinophil myelocyte, the size will be similar, the NC ratio will be similar. That is, the size is between 10 to 18 micron, and the NC ratio is 2:1. Now coming on to the nucleus. First we'll discuss the shape. So shape is round to oval, as you can see in all the 3 granulocytes. The nucleus shape is round to oval. The color is dark purple. The chromatin is coarser, and early stages may have nucleoli. Usually it is absent. It is not seen in the myelocyte stage. The cytoplasm is pinkish blue. Now, these are the important characteristic feature of the granules of all the 3 granulocytes. They are differentiated on the basis of granules present in their cytoplasm. So, eosinophil myelocyte, they will have large, round, orange blue to orange brown granules in their cytoplasm, as you can see. Now neutrophil myelocyte, it will have small reddish to bluish granules in its cytoplasm. Basophil, it has large, coarse, dark bluish purple or bluish black granule in its cytoplasm. So always remember, eosinophil have orange blue to orange brown granules. Neutrophil will have small reddish to bluish granules, and basophil will have dark bluish purple to bluish black granules. And it has coarse granules and large granules as compared to other two stages. Now coming on to the next stage, that is metamyelocyte. The first stage we have studied is myeloblast. The next stage is promyelocyte. The third stage is myelocyte. We have studied this stage for eosinophil, neutrophil and basophil. Now the next, that is the fourth stage, is metamyelocyte. In the similar way, we'll study it for eosinophil, neutrophil, basophil. All the features are same in this metamyelocyte stage of 3 granulocyte except for the granules. So the size is between 10 to 15 micron. The NC ratio is 1:1. Now coming on to the nucleus. In the metamyelocyte, remember the nucleus is indented or kidney shaped. The color is same, that is dark purple. The chromatin is coarser and there are no nucleoli. These three features are same as myelocyte. The difference is the shape. The shape of the nucleus in metamyelocyte is indented or kidney shaped. The cytoplasm is pink blue in color. The granules for eosinophil, same, that is bright orange to reddish. For neutrophil, reddish bluish, and for basophil, large dark blue granules. Now coming on to the next stage, that is band form. Fifth stage is band form. For eosinophil, the size is eosinophil band form, the size is 9 to 15. Similar for all the rest of the two. Similarly, the NC ratio is 1:1. Now in band form, the nucleus is band shape or C shape indented. Rest three features are same for myelocyte, metamyelocyte and band form. The nucleus is dark purple in color, the chromatin is coarse and there are no nucleoli. We have to distinguish on the basis of granules and the shape of nucleus. So in band form, the granules in eosinophil are orange reddish. In neutrophil, pinkish blue and they are fine. Basophil, large dark bluish to bluish black, as you can see in the figure. Now coming on to the mature form. Now the mature form of eosinophil, neutrophil and basophil. The size is 10 to 16 micron. Now the nucleus of eosinophil and basophil is bilobed. And in neutrophil, the nucleus is multilobed, that is between 2 to 5. Rest other three features are same. That is, the color of the nucleus is dark purple, coarser chromatin, no nucleoli. So they are distinguished on the basis of nuclear lobes. For eosinophil and basophil, they are bilobed and neutrophil is multilobed, 2 to 5 lobes. The rest other features are same for all the three. That is, the color of the nucleus is dark purple, they have clumped chromatin or coarser chromatin, no nucleoli. Now coming on to the color of cytoplasm, it is pink to blue. in mature form of granulocytes, that is eosinophil, neutrophil and basophil. Now this is the important feature, distinguished feature, that is color of granules. Mature eosinophil have large round uniform reddish to orange granules. Neutrophil will have small pink to rose violet to bluish granule. And basophil, it has dark, blue, black coarse granules. Large, coarse granules. Remember, it has coarse granules that are black, blue in color. And the important feature is the granules are very coarse, so they cover the nucleus. So nucleus is obscured by granules, that is nucleus is not visible. It is covered by granules. Nucleus is obscured by granules, very important point. So this is the figure of mature eosinophil. The nucleus is bilobed, purple color, and the cytoplasm is pinkish or bluish. They have granules that are large, uniform, reddish orange granules. The nucleus is spectacle shaped. Neutrophil, it is multi-lobed, that is 2 to 5. The color of the nucleus is purple and the chromatin is clumped or coarser. There is no nucleoli. The cytoplasm is pink blue and the granules are small and they are pink to rose violet. Basophil, it has coarse granules, blue to bluish black granules which will obscure the nucleus. This is all about the granulocyte series, that is formation of neutrophil, eosinophil and basophil. This is the granulocyte series. And I'm repeating the stages. The first stage is myeloblast. The second stage is promyelocyte, myelocyte, metamyelocyte, then band form, and then finally the mature form, that is eosinophil, neutrophil, basophil. So this is all about the granulocyte series. Now coming on to the next, that is monocyte macrophage series, that is formation of monocyte. It includes 3 stages, that is monoblast, promonocyte and monocyte. Monoblast will give rise to promonocyte and it will give rise to monocyte. It is a agranulocyte. Now coming on to the stages. The first is monoblast. We are going to discuss the size, nucleic features and cytoplasmic features. The nucleus again will first tell about the shape, then the color, then the chromatin and then the nucleoli. As a similar in granulocyte series. Now first monoblast, the size is 14 to 21. The size is same in all the 3 stages. Now the nucleus, it is round to oval and the color is light purplish. The chromatin is fine and there are 1 to 4 nucleoli. Cytoplasm, it is bluish in color but there are no granules. And there are occasional vacuoles. These white spots in the cytoplasm, these are vacuoles, sometimes present occasionally. And these white spots, they are nucleoli, that is 1 to 4 in the nucleus. Now coming on to the next stage, that is promonocyte. In this, the nucleus is indented. The color is same, that is light purplish. The chromatin is fine. The nucleoli are 1 to 5. The cytoplasm is blue-gray in color and it have occasional vacuoles. The nucleus shape is important, that is for promonocyte it is indented. And monocyte, the nucleus is horseshoe shaped or indented. The nucleus color is purple and the chromatin is fine. It is fine in all the three stages, and other important feature is there are no nucleoli. The cytoplasm is again bluish grey in color. So these, the monocyte macrophage series, you have to tell the shape of nucleus. That is very important. For monoblast, it is round to oval. Promonocyte indented. And monocyte, is it horseshoe shaped or indented? It has nucleoli, no nucleoli. And there are no granules in the cytoplasm, as it is agranulocyte. So remember, the stages in monocyte macrophage series are monoblast, promonocyte and monocyte. Lymphoid series, it involved two stages, that is lymphoblast. Remember, in all the three series, the first immature form is blast. And here you have to write the name of the cell. That is, we are discussing the lymphoid series, so it is lymphoblast. It will give rise to lymphocyte. Now, coming on to the stages, that is, first is lymphoblast, then lymphocyte. The size is 10 to 22. The nucleus is round to oval, centrally or eccentric. The color is reddish purple. The chromatin is fine and there are nucleoli 1 to 2, as you can see. The cytoplasm is moderate, dark blue in color, and there are no granules. Now the mature form, that is lymphocyte, the size decreases. It is between 7 to 15 micron. Now the nucleus, it is round and it occupies most of the space in the cell. The cytoplasm is scanty. Only the rim of cytoplasm is visible. The color of the nucleus is deep purple. Chromatin is coarser and there are no nucleoli. The cytoplasm is scanty, light bluish in color, and there are no granules. There are only two stages in the lymphoid series, that is lymphoblast and lymphocyte. The size of lymphoblast is large as compared to lymphocyte, and the cytoplasm is more, that is in moderate amount as compared to lymphocyte. The lymphocyte, the size is 7 to 15 and the nucleus is round and it occupies most of the cell. That is, only the rim of cytoplasm is visible. Now, regulation of leukopoiesis. If there is granulopenia or dead granulocytes and monocytes, they will release various colony stimulating factors which help in their formation. That is granulocyte colony stimulating factor, macrophage colony stimulating factor, granulocyte macrophage colony stimulating factor, and various interleukins. They'll stimulate bone marrow and it will increase formation of granulocytes, monocytes and macrophages. If their normal count is reached, then they will inhibit the bone marrow for further production. This is all about leukopoiesis.